Hello, my name is Lars Lepine from Johnson, family of Johnson & Johnson companies, and we are really, really honored to support this initiative because we believe that it can make a big change. Why? At Johnson, we believe that cancer should be a manageable and at the end of the day, a curable disease. But this doesn't happen in the lab. It happens, as a teamwork of all of us. Patient societies, doctors, of course, pharmaceutical companies, caregivers, but most important, patients, and the focus should be on the patient. What we know when we talk about prostate cancer is that in this region, the incidence is pretty low. We think it's not that low in numbers because the patients are not there. We think and we believe, and as a team, this is why we have this campaign. We think the diagnosis rate is really low. So the question is, what can we do in order to increase the diagnosis rate? Because at an earlier stage, this treatment can be cured, and we're really, really proud to have changed the paradigm of the disease. Once it was a deadly disease, now it's a chronic disease, and we envision that it's a curable disease for most of the patients at some point in time. But we need early detection and early screening. And this campaign is all about this, bringing the patient back to life, making sure that we treat the patient before it becomes a later stage disease because the chances and the quality of life are so much better. So prostate cancer you can feel in the early stage, and that's really, what's really careful about it. So we want to make sure that we detect it early and then as a team treat it early so that the patients can live a long life with a high quality of life, and no patient should be left behind.
Bismillah ar-Rahman ar-Rahim. Abdulqadir al-Zaraoni, President of Emirate Geological Society. This is the initiative for the prostate cancer screening program we initiated with collaboration of Ministry of Health and Dubai Health Authorities, by which we want to do the screening for the prostate cancer. We wish we can cover all UAE. As you know, the prostate cancer, if I'm detected in the early stage, the treatment almost 100%. But unfortunately, if it discovered late, then treatment or the cure will reach to 30%. Therefore, the prevention is always better than the treatment, and the treatment is available. Therefore, we said, let us start to do this kind of screening for the age, for men between 50s and 69 or 70 years old, and to see how, where is UAE among the other countries in the world. And according to the outcome, and we can put our recommendation. Do we need to put the prostate cancer treatment or screening as a top priorities, or no, it will come second or third according to our, the outcome. Therefore, any diseases, if the prevention is much better than the treatment, of course. Therefore, with collaboration of others, and also we can achieve, our, aim. It is, and this awareness is, this campaign will not concentrate only about collecting blood sample and so on. No, also we have an awareness for the publics, for physicians in general, urologists, and also beside that there will be a mobile clinic, which we are going. We're going to do the basic examination and PSA collection, and after that will be for the second stage. We're going to analyze all these data and the cases where there is suspicious of malignancy. Then there is a further management until we reach to the treatment. Therefore, this will not be only for detection. No, also we will go further until the treatment, inshallah, with collaboration with the other health care facilities in UAE, inshallah.
We are representing the Emirates Urological Society and the Dubai Health Authority to introduce the campaign of prostate cancer screening campaign, which is going to basically screen patients in a specific age group between 50 and 69 to detect the presence of prostate cancer as an early detection campaign, which can ultimately help patients in having a rapid treatment and a cure from the potential problem. Prostate cancer is a cancer which involves men. The main age group is between 50 and 70. So that's why our campaign is focusing on this age group. It doesn't mean that we are not going to do screening for patients who are elder nor younger, but the main focus would be for the patients at risk who are in between 50 and 69 years of old. The test would be a simple blood test, which would give an indication whether the patient has the risk of prostate cancer or not. So then we can divide patients in two different groups: patients who are not in risk and patients who have risk that they might have prostate cancer. The second group will be invited for further investigations to diagnose or to know whether they have prostate cancer or not.
Dr. Moza Al-Sharhan, President of the Emirates Medical Association. We are supporting the campaign of awareness about prostate cancer held by the Society of Urology. Wishing them all the best.
As we are trying to support all the activities of all the health education programs, if we take it from this, and we are talking about the prostate cancer campaign awareness. This is part of the activities of Sheikh Hamdan Award for Medical Sciences. This is based on the directives of Sheikh Hamdan bin Rashid Al Maktoum, Deputy Ruler of Dubai, Minister of Finance and President of Dubai Health Authority. We are, since the beginning of the Urology Society activities, we are there together in all their activities. And all what we aim through this, with their aim, that we encourage all the activities, encourage all the community, encourage all the people to support this campaign for the best of the community. Thank you very much.